Hey, good afternoon, or good morning, whatever.
Good afternoon.
Hey,
Well,
Sid.
hi, Miss Crystal. How
Hello, Senator
everybody?
Hicks Hudson.
How y'all doing?
Doing well, doing well. Excited to
Hi, Miss
present
Crystal
today.
King. How are you? I'm excited for you to present. But you're in great hands with Khadijah and Amber. They're the true queens that operate this whole program for us.
And Senator, I just want to let you know we are live. We just opened it up to all the participants as well.
Okay. Well, I'm still gonna give you guys your kudos. So are we ready to get started?
Yeah, we,
Yep.
we can go ahead and get started. And Senator Ingram, I don't know, your microphone was muted. I didn't know if you were trying to say something, but it was muted. Well, those were amazing remarks from Senator Ingram, I'm sure. We can go ahead and just get started.
Yeah,
Thank
go and get started. Mhm.
you for being here. Happy June. Thank you, Crystal and Amber from Queens Village, Toledo, for being here today. We have an exciting webinar for you all, and this is also our last one before we take a break to rest and reset for the summer. So we're super excited to have some Toledo folks wrapping up this first half of our year and sharing some wonderful information with us. And here's just a little overview about Queens Village Toledo. It's a program that operates, up in Toledo in the Northwest Ohio Pathways Hub. And they're doing a lot of work up there to ensure our families and babies have resources and access to support systems to, ensure they have, positive birth experience, positive postpartum experiences, and just overall healthier families. And we have Crystal King, who is the Senior Coordinator of Community Health Initiatives, and she leads the Queens Village and Partners for Change work in Lucas County. And then we also have Amber Curry, Certified Health Education Specialist and Pathways Hub Coordinator. So we're very grateful to have you all here today to join us. And if you're ready, you can go ahead and share your slides. We'll stop sharing ours and go right into your presentation.
Awesome. I'll start sharing. Here. Uh-oh. Can you all see? I'll put it in presenter mode too. Is this good? Okay. Awesome. Well, hello, everyone. Good afternoon. Actually, it just turned noon. But like Deja said, I am Crystal King, Senior Coordinator for Community Health Initiatives at HCNO here in Lucas County. And I am super passionate about Queens Village. I started actually right after I graduated from college. So I've been here for about 5 years now. And it has been just truly an amazing journey getting to know all of the families here in Lucas County and really just providing that support for our Black women and families here. Um, a little bit just about me is my mother actually experienced infant mortality, and I didn't realize it until I really kind of started in this public health realm. But public health really like found me, and I really do believe it's a calling, and I just love what I do every single day. So that's a little bit about me, and I'll pass it to Amber.
Hi, everyone. My name is Amber Curry. I am a hub coordinator at HCNO, and I decided to pursue a career in public health and health education because I grew up in poverty and I know what it feels like to have a lack of knowledge and resources to live a healthy life. So I am very passionate about addressing health disparities in the Black community, and our work in maternal and infant health is very personal and important to me because I have had friends who have lost babies and their own lives. And I am also a mom and know all about the struggles that go along with being a parent. So thank you for having us this afternoon. All right, so I'll get started with our why. So in Queens Village, we are shifting not only racial disparities in birth outcomes, but also the conditions that drive inequity in maternal and infant health. It is key to provide support for women who are at the greatest risk of infant and maternal mortality. Who we are. So Queens Village is a supportive community for Black women who come together to rest, relax, and repower and take care of themselves and each other. We offer a unique approach to reducing infant mortality by providing a safe space for mothers to be supported by their peers, to relieve chronic stress, and to learn about factors that affect their health. We support our village members before, during, and after pregnancy because the preparation for a healthy pregnancy starts long before a woman gets pregnant. And we were founded in Cincinnati, Ohio in 2018 by Dr. Meredith Smith and launched in 2022 as a program of HCNO and the Northwest Ohio Pathways Hub to further address the Black infant mortality rate in our community and support infant vitality. So our pillars. First, rest, relax, and repower. Reduce Black women's stress by creating space for them to relax, rest, and repower. Change the narrative. Change the narrative about Black women by creating spaces and content for and by Black women that celebrate and amplify their voices. Invest in Black women's leadership with social capital and power through community advisory boards. Create opportunities. So we create economic and professional pathways for Black women to succeed and flourish. And then lastly, engage communities by engaging with social, political, and medical communities to support equity initiatives and reduce implicit bias that affects Black women. All right, so we reduce Black women's chronic stress by creating space for them to relax, rest, and repower. Our wellness activities are designed to reduce stress levels among Black women by creating intentional space to slow down, rest, and reconnect. Our events are guided by annual participant surveys to ensure programming reflects the expressed needs and priorities of the community. We intentionally incorporate joy and fun into wellness, recognizing that healing and stress reduction can also come through enjoyment, connection, and shared experiences. We offer both large and intergenerational village events and targeted programming for new and expecting moms. Our large wellness events focus on stress reduction, health education, and advocacy, and include group fitness classes and community walks, conversations on chronic disease prevention and management, such as hypertension and diabetes, and then wellness education that expands beyond traditional self-care practices. We have wellness retreats that are designed to explore the full dimensions of wellness, including emotional, physical, mental, and social well-being, providing deeper restoration and reflection. Our sister circles are intimate gatherings designed to create a space for Black women to share experiences, build trust, and receive support. These circles center healing, connection, and storytelling, allowing participants to speak openly about motherhood, life stressors, and wellness in judgment-free environment. Queens Village offers targeted programming designed specifically to support new and expecting moms through education, emotional support, and connection to care. Biweekly support groups are facilitated with a licensed mental health provider present to support participants and a doula. These events address a wide range of stressors impacting pregnancy and postpartum well-being. Topics include attachment and bonding, perinatal mental health and depression, defining family values and support systems, staying active during pregnancy and postpartum, nutrition and healthy eating, including cooking classes, preeclampsia awareness and education, infant safe sleep practices, and personal goal setting and planning. Parent circles provide additional supportive space for mothers to connect and learn practical parenting strategies. We will begin holding classes this fall, walking through the Triple P baby curriculum, helping to strengthen positive parenting skills and early childhood development. Our Bloom and Thrive is an annual signature event funded by the Ohio Commission on Minority Health. The event brings together mothers, families, and community partners for a day of education, support, and celebration. Programming includes panel discussions on maternal infant health, breastfeeding one-on-one support, child and maternal safety education, community resource connections, as well as wellness and safe care practices, including pampering services. These events also serve as a critical touchpoint for identifying and supporting participants who may be falling through the cracks of existing systems. So we change the narrative about Black women by creating spaces and content for and by Black women that celebrate and amplify their voices. We use what we hear from our community and what we know to be true to help change the narrative about Black families. Too often, only part of the story is told. We work to share the full story, highlighting both the challenges and strengths of our community. Our goal is to shift mindsets, challenge assumptions, and promote a more accurate and respectful view of our families. We invest in Black women's leadership with social capital and power through community advisory boards. Our Community Advisory Board, or CAB, is made up of 10 Black women from the community who bring diverse perspectives, experiences, and educational backgrounds, as well as economic levels, consisting of doulas, social workers, community health workers, registered nurses, and mothers from the community. Their lived experiences help ensure that Queens Village remains community-driven and responsive to the needs of Black families. The CAB also plays a critical role in shaping our work. They help identify priorities based on what they are personally experiencing, observing, and hearing from other community members. Their insights guide our programming, advocacy efforts, and strategic direction, ensuring that our initiatives address real community needs and reflect the voices of those most impacted. We host yearly retreats and provide trainings to help them better serve our community.
Okay, so now I'll get started with creating opportunities. So we create opportunities and economic pathways for Black women to thrive and flourish. So one of the biggest ways that we do this is by providing spaces that highlight Black women-owned businesses, and also working with them whenever possible. So we also work with growing businesses. We realize that it's really a privilege to be able to do a business like full time. And a lot of our business owners actually have, full-time jobs, but also are trying to like grow their business at the same time. So we like to work with Black women-owned businesses whenever possible, and really support them. We've heard just really a lot from them saying that Queens Village, like if we've asked them to host like a workshop or anything like that, like this might have been their first time doing it, and they always do so well. But it's always interesting to like hear that We've also had grants in the past, many grants for new nonprofit organizations. And that seed funding really helps them to really show that their program works. A lot of them are starting these programs from a story, from an experience that they already have. But as we know that a lot of Black run nonprofits and things like that, it's hard to get started. Actually, my husband has a nonprofit, so I'm very involved there. And I know like the importance of like that seed funding and really like showing the impact that grassroots organizations have. We also offer financial wellness workshops and also our Queens Thrive Fund, which we introduced last year. So Queens Thrive is so powerful because basically we heard from the community different things that were contributing to their stress levels. So one in particular is parenting. So we actually have a licensed parenting coach and daycare provider for over 20 years, childcare provider for over 20 years to actually do sessions with our moms. We have financial wellness coaching that helps them to improve their credit and really like walk with them as they're improving their financial predicament. We also we try to, this is not only for moms who are on Medicaid, but all Black women as well. So we also offer some doula support because we know that doula services are covered through Medicaid. But for moms who are really like in the gap and, you know, are working and middle class mothers, they were saying that they would love to have a doula, but they don't have the opportunity to because sometimes it's not provided through their insurance. Sometimes it is. So we try to really step in and fill like those gaps as well. We also have offered like baby items through the Queens Thrive Fund because that has caused like a lot of stress in our community, we have heard. So that really just gives them the chance to buy baby items if they don't have that other support. Some moms are not able to have baby showers, so we really try to fill in that gap as the village. Okay, so going to the next pillar, engage communities. So we engage social, political, and medical communities. And we really look at ourselves as bridge builders. So building a bridge, I love this picture for one. This was from the summit in I believe it was April that you all hosted. But basically we hear things from the community, but we vision ourselves as the bridge builders to really get it to the ears of people who need to hear it. So this is social, political, and also medical communities. We're also connected with community organizations with a shared vision of positively impacting maternal and infant health outcomes. And we are members of local advisory boards. So a couple of our members are members of the Getting to One Coalition here in Lucas County, of the Commission on Minority Health here, the Office on Minority Health, like the local one here in Toledo, and many other advisory boards as well. And we are also leaders in the Partners for Change initiative, which I'll get into in a couple slides. So this is actually something that we created this year. We did a presentation with Mercy Health here in Lucas County, and basically we talked about really how to provide compassionate care for Black families and to really like shift the mindset of our healthcare providers and what they believe about Black women, because a lot of it is really experiencing the care, it's impacting the care that they receive. So one of the things that we actually talked about was really reframing our thoughts. So if a family is not showing up to their prenatal appointments, it's easy for us to think, oh, they don't care about their health care, they don't care about their child. We can make big assumptions. However, we challenge them to really like think differently, to really ask deeper questions. What may be preventing them from accessing medical care? What feelings do they have when they access medical care and things like that? So we're really excited to continue this conversation, especially through the Partners for Change work that we're working on. But this is like a quick guide that we left with them on compassionate care. And this was all really based on feedback that we heard from the community. So we have data here. We also have principles for compassionate care. And we really tried to make it as streamlined as possible and simple as possible. We talked about small actions that make a big difference as well, and also an accountability check. And asking themselves, not in, condemnation or shame, but really so they can improve, like moving forward. So we're really proud about this. And then the next thing that we created was an empowerment worksheet. And this is actually a worksheet that our community members fills out. And a lot of the times they fill them out with their community health workers. So this really helps to prepare women to attend their healthcare appointments, to advocate for themselves and their families, and also to take any follow-up steps to continue to nurture their health. And then on the back, we have included resources. So resources to get connected with Queens Village, also to get connected with the community health worker, to know their rights as a patient, and also if they want to share negative or positive experiences that happen at their healthcare appointment. And that can be accessed at that QR code and the link. Okay, so now I'll get into Partners for Change. So Partners for Change is actually an initiative that is through the governor's office and also the Department of Children and Youth, the Ohio Department of Children and Youth. And it's actually a collective impact initiative that gathers infant mortality prevention stakeholders to respond to the needs of the community by co-creating solutions with them. So this is expanding Cradle Cincinnati's model for infant mortality reduction. The key components are data, focus, collective impact, and community engagement, and also the learning collaborative. So data, we realize that the data is really helping us to tell the story on where infant mortality is happening in our communities, why it's happening, but also we recognize that it doesn't tell the full picture. So that's why we have hosted community listening sessions to really gather qualitative data as well. And then focus, we will be focusing on the areas that have the highest rates of infant mortality, and then the collective impact and community engagement. So realizing that the solutions are in the community, and really we have to get to the bottom of that. And then the Learning Collaborative. So the Learning Collaborative is actually a group of providers at our local healthcare systems who will be really committed to reducing infant mortality and just putting additional practices in putting additional tools into practice to really better the experiences of Black families in our community. And then this initiative was launched in 4 different counties. So Lucas County, Cuyahoga County, Montgomery County, and also Franklin County. And our current activities that we've done through the first part of the year, we did 5 listening sessions in the target zip codes in Lucas County. And after those listening sessions, we found themes that kept, recurring themes. And I'll get into those on the next slide. But we also, after we did the listening sessions, we went into co-creation sessions where we brought the community and we brought healthcare providers and service providers to the table to really develop interventions. And all of the pictures that you see on these slides are real. So we love using real pictures because it really tells the story of our work. So on this picture, you'll see we were discussing different goals. And I believe this was the session on really helping Black families to have a better experience in the healthcare system. So we actually had a midwife. She was present as well. And we also had doulas and, different stakeholders as well from our community. Okay, so going into Queens Village role and Partners for Change. So we will be amplifying lived experiences, and we have been as well, bridging community and systems. So really being that trusted bridge builder, because our community really trusts us a lot. And it means a lot to us to foster that trust, to continue to foster the trust, and also to not drop the ball on that trust as well. And then leading community conversations. So Amber talked about our community advisory board members. So they actually led these discussions. They facilitated these conversations and asked questions, and it really helped the families to open up and really like tell their real authentic stories. And also the community advisory board will be setting intervention priorities. So we have lots of priorities that we've outlined, but the community advisory board will really help to direct where we put our resources first. And then without community members at the greatest risk of infant mortality at the decision-making table, solutions miss the mark and disparities persist. So we are trying to really make impact and lasting change in our communities. Okay, so here are some of the themes that were identified. So we have assets, but we also have gaps and barriers. So the first asset is the power of community-based support. So a lot of families really highlighted the great support that already exists in our community. So we have a lot of different resources in our community, but you'll see below in the gaps, sometimes it's a lack of integrated resource navigation, but we do have really good and trusted resources in the community. Also, personal faith and also personal resiliency were two assets that were identified as well. And then the gaps that were identified were mental strain and emotional exhaustion. There were a lot of mothers that really stated that that pregnancy and the perinatal period was really bittersweet for them. And they were really tired, and it was just like a lot of trauma also coming up during this period. And the next one is racial bias and lack of respectful care. We've heard countless of stories about this, but we're really excited to make change in this area. And then the lack of integrated resource navigation, I just mentioned that, and isolation and lack of personal support networks. So a lot of families really talked about some of the families like moved here from other states. Others really didn't have that family support or even friendships and things like that. And then the last one was economic insecurity and housing instability. So we saw a lot of parents really saying that pregnancy was bittersweet. So they were excited to meet their baby, but also unsure on how they were going to really sustain themselves after pregnancy as well. And we see a lot of the, especially in the parent support and the leave and things like that, that is definitely an area of opportunity as well that we identified. Okay, so moving on to our 2025 impact. So in 2025, Queens Village hosted 35 community events. We sold over 1,600 tickets, and we also provided over 350 lift rides. So we had over 500 participants engaged with Queens Village in 2025, and we also have many returning participants as well. So this is actually very important because they find such a solace and a safe space in Queens Village that they come back and they bring their friends. And we have really spread a lot by word of mouth, and also social media and posting flyers and all of our community partners as well. But it's primarily word of mouth. And we look at that on our like intake forms and things like that. So that just speaks a lot to the program. And we're really grateful to provide such a safe space that they continue to come back, continue to make this village a true village. And then over 350 lift rides were scheduled. So we actually provide transportation and childcare for most of our events. So transportation for all of our events, but childcare was actually provided at 95% of our in-person events. And we really see this, we saw these barriers early on, And it was very important for us to address them because it actually it provided more stress. They knew that, the community was there for them and, the events were present and things like that. But just the stress of getting there and what am I going to do with my child, when I get there. So we actually have a licensed childcare provider, and her staff members actually provide childcare. So that has been really just monumental for us. And then last year we invested over $14,000 from the Queens Thrive Fund from October to December, and we have also continued that fund this year as well. And one of our biggest successes, I would say, is really the connection that we're seeing from a safe and supportive space to trauma healing groups to individual counseling services. So, a lot of our community members have experienced different types of trauma, complex trauma, and we have actually connected in 2025, we connected 17 new and expecting mothers to an external trauma healing group and also 10 to individual counseling services. And the impact that we have seen just with them, going and diving in and really beginning to start that like healing journey has been just very impactful. Also, in the listening sessions, we heard a lot about how mental health actually is affecting a lot of other things. So it affects if you want to get out of bed, if you feel motivated to, go to work, or, how you show up for your children and things like that. So we have really heard a lot about trauma. So we are, moving and doing our due diligence to really help our village members. Okay, so here's the video. So that was actually a video from an event that Amber talked about. It was called Bloom and Thrive, but we typically do it every April, which is Minority Health Month, and also Black Maternal Health Week is in there as well. So we typically do that event, and it's beautiful all the time. And this year we had support people come and fathers, and it was really beautiful. And it really helped a lot as well. Okay, so I wanted to get into some village member testimonials to really hear from the village their experiences. So, one village member said, Queens Village helped me with breastfeeding, manage stress related to my blood pressure, and achieve my short term goals. Another community member said, my emotional and mental well being has improved greatly due to Queens Thrive. It greatly reduced my stress after being hospitalized for a month and having my baby 6 weeks early. The fund helped me to prepare for when my baby boy came home from the NICU. So this really speaks a lot because she didn't know, that she was going to be hospitalized. She was hospitalized for a month, which of course significantly, reduces the amount of, finances that are coming into the home. She also had other children at the time as well. And she applied to our Queens Thrive Fund and was really able to get assistance with baby items, so that she had everything that she needed when her baby boy came home. So we were really excited about that. And then the next one is during my pregnancy, the events alone helped me to get out the house and surround myself with other women, young and old, like myself, community made my pregnancy better. So this really speaks to the village model. We have an array of different queens in our village. We have older ladies and also younger ladies as well. And from the themes that we also got, we heard a lot that pregnancy is lonely. Even when you have people around, pregnancy is lonely. But it stood out to me that this queen really talked about how community made her pregnancy better. And then this was another quote that really stood out. Queens Village helped me out of my depression. So that just speaks wonders, honestly, just to the beauty of just a village of love and support, and things like that. So I'll go to the next one. Sorry about that. Okay, so this actually talks about kind of like some of the parenting tools. So it says the parenting tools I learned have helped me to stop yelling and reduce stress for both my children and myself. Another village member said, I made sure to attend all of my appointments and not assume that just because I was already a mom, it was okay to miss a few here and there. So even though, we have such a great, and supportive village, and we do restful activities, we also really talk a lot about health and wellness, and provide a lot of health education as well. Me and Amber, we both have a public health background, so that's, our bread and butter, but we make sure that we have those honest conversations about, breastfeeding, about infant safe sleep, about really like repairing relationships between parents and children and showing up and being the best, parent that they can be as well. And then Queens Village has equipped parents with tools to prepare for safer births, recognize complications early, and confidently navigate labor and delivery. We also talk a lot about the urgent maternal warning signs to look out for and when to seek help from a provider. And then 99% of survey respondents reported that Queens Village helps to reduce their stress levels. And this was our overall village. And then we also had a part of the survey for our new and expecting moms. And 86% of mothers reported improved stress management and emotional wellness during pregnancy, reducing risk of perinatal depression and isolation. Okay, so that's all that we have for you all today, but we are here for any questions that you might have about the program or anything that we said.
Thank you so much, Crystal and Amber, for the wonderful presentation. And it just seems like the amazing work that you all are doing in Lucas County and in the broader community as well. I do want to remind everyone, if you do have questions, you can either put them in the Q&A or I think you could be able to just raise your hand and speak. I think we have the ability to do that as well if you just want to ask your question directly. So if anyone has questions, please feel free.
Yeah, so there's one in the chat just asking if they could please receive these slides, just because they're a wonderful resource. And then also Angela Dawson has her hand up, so I'm going to go ahead and allow her to talk.
Director Dawson, you should be good if you want to say something. Just have to unmute yourself.
Director Dawson actually made a special appearance at our April event. So we were so grateful to have her and just to see her engaging with all of the families. So that was so special to us.
Well, we do have another message in the chat from Ava Spiles saying, just congratulating you on the amazing work that you're doing in Toledo and just sending so much appreciation to Queens Village and all the work that you're doing.
Thank you so much, Avis. We really appreciate you and really for just like your advocacy for fathers, and we are saying Black families because we are for the entire family. So I just really appreciate you and just your advocacy in the community too.
Dominique, you could probably go ahead if you're ready, if you have a question.
Yes, can you hear me?
Yes.
Yes, I was just wondering, after the Partners for Change listening session, what are some of the things that you guys are implementing in the Toledo area?
Yeah, so after the listening sessions, we definitely have a focus on doulas as one and really providing that support to the moms, especially to the families in the hospital as well. And we're really taking a look even at like hospital advocates and things like that, just like different routes that they can receive different support. We also kind of talked about maybe like having a support line that they can call into with the advocate on the other side of the phone if no one is available for in person, because we did hear that a couple moms actually, you know, delivered by themselves
Oh, wow.
and just how lonely that was. So definitely like that community-based really support we will be really implementing moving forward, and also emergency funds and expanding those as well, and making sure that, you know, the programs that we offer can continue in our community, because we have a lot of, you know, programs in terms of emergency assistance and things like that. But those, of course, dollars run out at times too. So really brainstorming ways to keep those things sustainable. Um, there's so much, Dominique, that I can talk about. I'm having a brain fart right now, but um, also advocacy, realizing just the need for advocacy and working with our policymakers to really show the need for policies. Um, there's so much, Dominique. So I would love to connect after too.
No, it's great. You guys are doing great work.
Thanks so much.
Come on. This is Paula Hicks-Hudson. I want to just say thank you so much for being on. I'm proud of the work you're doing and establishing a foothold here in Lucas County. Can you just talk a little bit, if you have the data, about you know, the number of folks that have said they wanted to have a midwife, or you know, or more extensive hands-on help from doulas, from the program, just kind of talk about that just a little bit if you can. Thanks.
Mhm. Yes, absolutely.
And
So
thank you for being here.
yes, absolutely. Thank you so much for having us. But yeah, so for our listening sessions, we actually surveyed over 50 moms. And out of those 50 moms, some have had support from doulas, but most did not, you know, and could not. So out of them, I don't have like the concrete numbers right now, but out of them, I would really estimate about really 30 out of 50 of them said that they would like a doula for their next pregnancy. And we also had mothers who, you know, were not on Medicaid who said that they would like access as well too. So that's just a little bit kind of about that.
Well, I'm going to butt in right now. This is Senator Ingram, and I couldn't get off mute at the beginning. So maybe that was for the best so you could go on and get started. But I want to say thank you so much for being the presenter today, because all of this work is very important. But I'm going to throw something out there, and I know that Director Dawson is on the line and my colleague, Senator Hicks Hudson, is on the line. I want to ask you about the report that came out from the nursing board. And if you don't have any knowledge of that, that's maybe something that we can talk about later. But what did you think about the report regarding their comments about doulas and the cost, or your thoughts about the report period, and how are you there in Toledo? And I've asked this of Dr. Smith here in Cincinnati. How are we addressing? How are we looking at having that conversation with the nursing board?
Mhm. Yes, Senator Ingram. I'm not familiar with the report, unfortunately. I'm sorry about that. But
No,
I definitely.
that's okay.
Mhm.
It's okay that you're not familiar, but that's a conversation that we do need to have.
Okay.
So we'll talk about that as we proceed, because it's a very important piece of the work that you do. That, as we see by the numbers, and somebody just asked the question, Senator Hicks Hudson, in regard to what do the people say? What do the people need, instead of us doing this little back and forth about whether or not doulas or midwives are necessary? That we've got to get this resolved as to what's most beneficial to the people. So I appreciate your presentation, and that's okay. We'll talk about it some other time.
Yes, absolutely. We did hear, I do have a couple other things that we did hear. So, one thing that we heard in the community was really not knowing how to access a doula as well. That there are some doulas in our community, but in Lucas County, there is a need for more support as well. We also attended a listening session for doulas and midwives in Toledo, and that was, I believe, through the Black Child Development Institute, and the Prenatal to 3 Coalition, I believe. And the so I'm excited for like when that report comes out, because they went to different communities like in Ohio, to really hear the experiences of doulas trying to get connected, and to build through Medicaid and things like that, and really the challenges that they experience and face in terms of claims. So I will definitely try to connect with them and try to see like where they are in the process and get that report as well, because I was really interested like in that conversation, and it's very, very important, just to the families who have no one else really, to have some type of support and really advocacy as well in hospitals.
Okay, great. Thank you. I appreciate that.
I'm just going to jump in just real quick and we can go to the next question too, just for clarity on the report that, Senator Ingram's referring to, and just for people on the call. I can share that with everybody after this call, but it was the report to the General Assembly coming from the dual advisory group, who are, operating within the Board of Nursing, reflecting on the past year of like how many doulas were certified in the state of Ohio, and kind of looking at just like a multitude of like outcomes and measurements regarding like that as well. I know there's been conversations in the past about delays in like maybe getting reimbursements, or kind of like delays in like who's getting approved, or what the process of being approved, what does that look like, and like what the rules were written as. So I know it's been an ongoing conversation, in this space as we've continued to like implement doulas being reimbursed through Medicaid. So that's what the report is about, is just like kind of the review of how many have been certified, things like that, and other details. But I can be sure to share that with everybody, so that you all can look at it. And I know it's only been like a year or so since that. So from the report, there was, conversations that, obviously more time and more people being involved will produce a more staunch kind of like comparison of like if it has it, like what the greater impact is. I mean, but we already know based on everything that doulas do help, with improving maternal and infant health outcomes. But this is just specific to the last year since it's been implemented in Ohio. But I can share that with everybody. Just wanted to give context.
Mhm. Thank you so much, Deja. Yes. I mean, from that session, we heard, like so much. There were also doulas who came from Michigan too. So it was interesting to hear like their experiences as well. And they actually have like a platform. It's called Meet May. So I researched it and I was like, wow, this is really amazing and it looks pretty helpful as well. And the doula said it was very helpful when, like they didn't sign up to be like just really helping to take the administrative burden out of it, because a lot of them don't do this full time too, was really important.
Right. No, certainly. And I'm just looking, sorry, I'm also looking through to make sure. I see that we have Dwayne hand raised, and
Are we at 2 or 1? Is private 2 or 1?
I am so sorry. Did I raise my hand on accident? I wondered why I got the message that I had been unmuted. But you can take me off the mic. I'm sitting on my hands and listening to the wonderful presentation. Good to see you again, both Crystal and Amber. All of us are from Toledo.
Nice to see you, Dwayne. Happy that you're back too.
And it looks like we're having some conversation happening in the chat and everything. And I want to make sure that, folks that are giving contact information, emails, and just other, like I said, with that report that we can share, I just want to make sure that to let everyone know we're seeing that, and we can definitely distribute the information and get everyone connected. That's kind of conversating in the chat right now. And we'll be sure to share Crystal and Amber's information. I mean, if that's fine with you all, can share the email after this. And if anyone else has questions or comments they'd like to make, we're coming up 12:53 right now. We don't want to keep you too long, but if you have anything else you need to say, please feel free. Let's see.
I can comment on the report if you guys don't mind.
Go ahead.
I'm Dominique from Groundwork, Ohio, and we did. I was there when they in Senate Health, when they had some concerns about the cost, because nationally overall, they say that the cost associated with having a doula is lower, but with the report to the legislators, the cost seemed to be, I think, 3,500 more for those who had doulas. So that was a concern, or how much it would cost overall. But the numbers are very low when you look at how many people are involved. But also they have better results as far as getting to prenatal care earlier, which will automatically give you a higher cost. If you start at before 9 weeks versus someone who starts at like second semester, that's already going to raise the cost of doula services. And then there's no real cost to like infant loss, right? Like what are those numbers? So when you look at a doula services, if they're helping moms being connected to breastfeeding more, which is some of the data that they showed, and those postpartum supports more frequently, that can stop infant and maternal mortality. So you have to look deeper into the data to find out more than just like a cost analysis for such a small group. I would rather refer to like a national where they have like more data than something so small to when you're thinking about like the cost benefit.
Absolutely. This is Senator Ingram again, and thank you for that. And part of the conversation, because remember, we're here in Ohio.
Mm-hmm.
As legislators, Hicks Hudson and I have to look at what we're trying to get through, and because this has been a struggle for a while, and then to get it done, and then to turn around and say, here's what we've got. So we still have to be prepared to counter that information with facts. And I'm sure that Director Dawson would say the same thing, because the facts, the data is what makes the difference.
Groundwork did, I had reached out because that was on Senate Bill 267 when they had those concerns. I did reach out to Reynolds and Craig to give more detail on like some other parts about it, more detailed analysis on the whole report and not just pulling out one part of it to kind of.
Right. So thank you for that. I appreciate that because they seem to have been caught off guard. And I want to make sure that we're always able to push back when we're trying to do one thing with legislation, which was that bill was pretty simple, and then to come back and say, oh my God, look what it's called. And so we don't want to get caught up in that. So I appreciate your doing that and doing that. So we'll continue to have those conversations. So thank you.
Thank you.
And this is, and I thank you, Senator, for saying that because that's exactly what I was thinking as well. And thank you, Dominique, for kind of level setting what that report says. And I'm hoping that I put in the chat that we as part of this organization and our meetings will be able to work on some, I don't call it a critique, but a response to it so that we can continue to fight. I'll just say very quickly that I was contacted by someone who has all types of ways to gather information, and she didn't know where to find a doula in Lucas County. And so I was and I think we have to do a better job of educating and getting the word out that it does exist more as well. So I applaud everyone that's in the space. And I think everyone, who cares as much as we care about having healthy babies and healthy moms.
Well, thank you all again so much for joining us today. Crystal, Amber, thank you so much for, topping off the first half this year with such a wonderful presentation and just being a part of this work and everyone that showed up to all of our monthly meetings. In the last, year, a couple of years now that, we've been trying to make sure we're really consistent and not letting the ball drop. And our summit that was in April. Everyone on this call and you all make this happen, and I think it does put pressure, at least from my perspective. I think seeing the work that we're doing, I think it is continuing to make sure that this continues to be a priority here. As we break for the summer, we'll be doing kind of like a recap, maybe like a newsletter kind of thing with links to all of our previous videos, to our summit, maybe some recap on legislation or other things that might have been happening in this past year or so for people to look at and think about as we get into the fall and the legislative session that's going to reconvene probably post election season, I'm assuming. I think we all got to be prepared to see what comes in lame duck. If there's anything crazy coming out, it always happens. So hopefully we can just continue to advocate and do the right thing for our moms and babies and continue to do that work, so just to give people, we'll be on break for a little while, but we'll be reconvening in the fall, maybe before the legislature returns. I don't know, Senator Ingram, Senator Hudson, I don't know if we'll wait all the way till November to restart, but maybe
there are no real breaks. We're going to give you July and we might give you August, but we'll see, because this work is continuing to be done. Just as everybody that's paying attention saw that the governor vetoed some things, there's a possibility we're going to come back for an override. But our job as legislators is to make sure we're paying attention to what's going on the ground. And bills are continually being introduced, despite the fact that they don't have to be heard in this particular GA. But I think we're gearing up for lame duck, as Deja alluded to, and for the next General Assembly, which starts in January. So thanks everybody for being here. I know it's 1:00, so Deja, take it away. Thank you.
Thanks again, everyone. Well, I'll be sure to follow up, and we have all the chats and all the contact information, so we'll make sure to coordinate that and get you all the information. And thanks again. Have a good rest of your day. Thanks for being here.
Thank you.